Good evening, everybody. I'm Dr. Janet Memark, and I'm here to give you a COVID update today. We'll start off today with the numbers, and so these are the numbers off the Department of Public Health, and we see some positive movement, and we're really excited to see this. And if you're following nationwide, it looks like we're very hopeful that we have hit the peak of this latest surge, and we pray that we are coming off of that. But when you look at the cases of the PCR numbers for per 100,000 over the last 2 weeks, it's down to 725. And then you can see as we're looking at our curve, or epi curve over to the right, that we maybe have hit the peak there and maybe coming off of that. What is unfortunate, though, is that we have had a lot of deaths in the county. We know from this pandemic that we will often see the cases first, and then you'll see hospitalizations, and you'll see deaths. And we've added just a huge number of deaths over the last week in our county, and we're up to 663. And you can see just a sustained kind of a curve that you see on the right of the number of deaths that we've had, the people who have succumbed to COVID-19. When you look at the cases, these are the total number of cases. That's the PCR number with those rapid antigens that have been included. So over 60,000 cases that we've been seeing throughout the district since the beginning of the pandemic. When we look at the 2-week case rate, this is the one I like to do. I like to include the antigens in there because they are positive cases, and it's down to 885. You might remember last time I came was probably over 1,100 per 100,000 people at that point. So we are definitely going in the right direction. We are seeing the number of deaths, though, that it continues to climb, but hopefully we'll see a slowdown of that soon. That's the last indicator that we see. Some also really good news is that we are seeing improvement in hospital admissions. And so from last week to this week, there's been a very nice drop, and we just pray that this keeps going in the right direction. But there have been some spaces that have been opened up in our area hospital. So it's definitely trending in the right direction for the county. I want to go ahead and just talk about the vaccines a little bit, and so just remind you where we are in our phases. And there's been a lot of discussion about that, and we're in that 1A plus phase because we added on the 65 and older. And so when I say we, this is actually decided by DPH and the governor's office in conjunction with the ACIP and CDC recommendations. And so we have gotten some emails and some questions about the phases and our deciding the phases. I just want to make sure everybody understood that we actually do not, on a local level, make any decisions about the who goes into the phases. And so we are locally just here really to try to execute what the governor and Georgia DPH has recommended. And so this is currently the phases that we see: the 65 and older, and our healthcare workers and frontline safety workers, as well as long-term care facility workers and residents as well. So we're talking about vaccines. This week we switched to a new system, and we had a little bit of a glitch with the system where we had some extra appointments that were scheduled. So we had to move those appointments, but I want to make sure everybody knows that your appointments you're not canceled, you're just moved back a little bit. And so so far we have at Cobb over the last month, we have given out 2,309 doses, and over 10,000 of those doses were in Cobb County and Jim Miller alone. Yesterday, they were able to do 690 doses, and then Douglas Health Center is ramping up as well, and they were able to do 216 doses. So we talked about our status. We had some scheduling issues. We share the same scheduling platform that Fulton and DeKalb uses, and so we feel like we've worked out some of the issues with the scheduling. And so unfortunately, though, what we're hearing is that the vaccine supply continues to be limited, and we do not expect any increase in our vaccine supply until about March or April. And that actually goes along with what we're hearing from the federal government. If you look on national news, that it's not anticipated that the production of vaccine will really have a measurable increase until about that time. So for the Moderna and Pfizer vaccines, that's what we anticipate. Now, we do have some hope for the AstraZeneca and the Johnson & Johnson vaccines. These two vaccines are a different mode than the Pfizer and the Moderna vaccines. They operate a little bit differently and are looking like single-dose vaccines. We anticipate that we may see them come out and go through EUA in the next few weeks. And so maybe in February or early March, we will see them come into production as well. And we had heard some kind of news that maybe they wouldn't be able to meet production promises, but today we heard that that at least Johnson & Johnson seems to be on target to meet the promises that were made. So that's good news so far. We are working with community partners, large community partners, on the creation of mass vaccination sites. And so this is in the very initial planning stages because we don't have enough vaccine right now. But we are gearing with the metro community to prepare to have big populations of our population to be vaccinated in large groups. And we as, the healthcare system as well as public health feel like this is really one of the only ways that we'll be able to vaccinate our population quickly. And that's all pending having vaccines available to us. So takeaways just that, from our update today, we do hope that we'll have more vaccine in the horizon, but it looks like we'll have to go through at least another month with having the same amount of vaccines are allocated to us right now. And I think we heard today that there was a request for over 2.3 million doses of vaccine by all of the providers that have requested and they're authorized. And only 80,000 are allocated outside of the long-term care facility. So that gives you an idea of how few vaccines are coming out compared to what the demand is across the state. There are some concerns for the variant states and the variant strains of COVID-19. You might have heard about this nationally. It is confirmed to be in Georgia, and we also have had a community case as well of that. We have different strains that are out there right now, and so we are keeping an eye on that because there is some concern of increased transmissibility as well as a question of if there's more virulence or if it could be more deadly. And so it is thought the vaccines will work against these strains, but the degree to how effective they are is still kind of in question right now. But we do know, and I know we've discussed this many times, that what works. And so as you get the vaccine, I've seen multiple cases of people who have gotten their first vaccine and then let their guard down and have become positive for COVID-19 soon after getting the first vaccine. So please remember that you only get limited protection after the first vaccine. We have to continue wearing our mask and keeping our distance and washing our hands, and really be really careful about gathering outside of your household until these case numbers can come down considerably. So, and it's going in the right direction, but let's if we let off the gas pedal on this, it can quickly go the wrong way. I just want to thank our public health folks. I know that we've taken a beating over the last few weeks, but we have some people that are working extremely hard and long hours to try to do as much as we possibly can for our community. And so we're working hard on that. And our healthcare folks that, I pray all the time that they will have some reprieve from how hard they've been working since the beginning of the pandemic. And our education heroes and Chairwoman Cupid mentioned about the teachers that we've lost to the pandemic. And I think every single one of them, we all it's just such a loss. And so many people that we have lost to this pandemic is really tough. I want to thank Cobb Fire as well for helping us to vaccinate our public safety folks and help us to do what we need to do to try to get as many people vaccinated as we possibly can. And thank you to Cobb County and letting us live at Jim Miller and doing the great work that we do. We were able to turn that quickly into a vaccine site within days, and that was truly helpful in helping our community get as many vaccines out there as possible. So we appreciate all your support and helping with that. That's all I have. There you go.
Well, thank you, Dr. Memark. We can never say thanks enough. And I want to personally thank you. I saw Lisa Crossman. Thank you, Lisa. Thank you for your heroic efforts, both of you. and not only responding to the correspondence that you've been receiving, but being out there in the field and helping to monitor and actually vaccinate some of the members of our community. Right now, I'm going to turn things over to our board to see if they have any questions. Yes, Commissioner Richardson.
I do want to say thank you guys so much for everything that you're doing for the community. And I know that it's been difficult in working with the constraints from the federal side, from the state side, and really just gauging all of your resources. So I do want to extend that offer. Any way that we can partner with you as the county, as the Board of Commissioners, in terms of resources or help or logistics, whatever that may be, please just let us know, and we are happy to accommodate because the community safety does come first for us. As another aspect to that, I did want to say as well, Dr. B. Mark, I've seen you take all the rounds on, I've seen you on a lot of different town halls, so I appreciate your commitment to doing as much as you can for bringing transparency with what's going on. And I know it's just really hard for everybody to keep pace and make this happen. So like I said, however we can be of help, let us know. And happy to partner with different community partners as well. So just keep us posted. Thank you.
Thank you, Commissioner. Are there any other comments or questions? Dr. Memark, if you can.
Yes.
Yes, is there someone else? Commissioner Burrow?
Yes, Madam Chair, yes, thank you. I would just like to echo your and Commissioner Richardson's sentiments and really thank these ladies and their staff and all the healthcare workers that are administering the vaccine and scheduling. It has been quite an ordeal and very challenging. And I really appreciate, especially Lisa Crossman, fielding some of the calls and emails that we're receiving and getting fireworks over. But really, it all comes down to safety and getting everybody that we can in that phase 1A vaccinated. I'm in that group. I've had my first dose. My second dose is coming up in a week and a half, so I'm really anxious and ready so that I can get back to work there at the office. But thank you so much, and like Commissioner Richardson said, we are here to help. I know we had a conversation today, Lisa, and please let us know how we can help. I know you're at the mercy of the state Georgia Department of Health and with the supply and all, and that is challenging as well right now. So just please let us know how we can partner with you to help our constituents and the public. God bless you for what you do. Thank you.
Thank you, Commissioner. We really, you all have been such a tremendous partner this entire past year as we've walked through this pandemic. And so I just can't say enough about your staff, the support for Jim Miller Park, all of your EMA and your public safety folks and Parks and Rec. I mean, the list goes on and on. We really, everywhere we've turned, you all have been willing to help. And most recently, we have been working quite a bit with senior services to figure out how we could better reach our vulnerable seniors and be able to get the vaccine out to them in the most convenient way when we have enough vaccine. So shout out to Cobb Senior Services as well.
Thank you, Lisa. Dr. Memark, there have been a couple of comments with respect to the second dose of the vaccine. Can you provide the public some information around that?
Yeah, absolutely. And so thank you for asking that. So our staff is working very hard right now to go ahead and schedule all of those second doses. So please, if you do not receive a notification, a few days before your second dose is due, just let us know, and we will, make sure that your second dose is scheduled out. We've had a few, and I'm talking very few folks that didn't have an email address or a phone number that was available. So, you can reach out to us and we'll make sure that we have that appointment for you. So we're scheduling all of those. And I've mentioned vaccine supplies are very limited right now. And so we're really prioritizing our second doses over the first doses. And so we just don't want to keep going and then find out that we're not going to have enough for the second doses. So we make sure that we get our second doses in, and if we have some extra, that we go ahead and schedule first doses on top of that. And so I want to assure everybody that you will get a second dose. Now, what's important to know here is that the CDC has released new guidelines on the second dose. And so, and we've mentioned this, I think, before, but there's been some more solid guidelines that they want you to be able to get as close to the date as possible. So for Pfizer, it's 21 days after the first dose, and for Moderna, it is 28 days. Now, that being said, in circumstances where there, is some shortages and stuff like that, you can go up to 42 days for both of the vaccines. So we are trying to be well within that 42 days. We're trying to get it as close as possible to that 28 day because we have Moderna. And so I just want to make sure everybody knew that don't be too anxious about it. The studies that were done were to see how quickly they could do the second dose. It didn't go into, how far out. And so the CDC feels very comfortable that 42 days that you're going to be okay. So I just want to make sure everybody knew that, and we will make sure that you get your second dose if you got it from us.
Thank you, Dr.
And Dr. Newmark, some folks have had a question about whether they needed to get back on our website to make an appointment for their second dose. We just want to make sure that everybody hears that if you got your first dose with Cobb and Douglas Public Health, that we will have staff reaching out to you, and you do not have to schedule that second dose on our website.
Thank you, Lisa and Dr. Memark. And what I'm hearing is that you'll reach out to them days before the second dose, so they may not hear from you immediately, because I'm getting some emails from people who are expecting an immediate, contact from public health, and they might not be within that window of a few days of their second vaccine.
Yeah, we hope that our scheduling program, the new one, they are able to stick in that second dose, but because we started it a little bit later in the process, we're making sure that the first ones are done a little bit more manually.
Okay, great.
And also making sure that we have vaccine in hand, because we don't want to schedule that second dose appointment and then have to cancel with you.
Yeah.
Thank you, we appreciate it. Again, I'll ask one more time, do any commissioners have any questions or comments? Thank you, ladies. We thank you so much for your time, especially considering all that you have going on every day in administering the vaccine. We truly appreciate all the work you and your team are doing to help keep our citizens safe. And again, as Commissioner Richardson and Commissioner Burrow shared, we want to be a partner, so just let us know how we can help.
We will. Thank you.
Thank you. Have a great evening.